Hi, my name is Victoria Paul, and today I'm going to take a few minutes to talk with you about medication errors, which is taught in the Nurse 330 course titled Law and Ethics for Healthcare Professionals in the University of Mount Olive's RN to BSN degree program. This video is an assignment for my Master of Science in Nursing degree program, which is also located at the University of Mount Olive. By the end of our time together, I plan to cover 3 objectives with you. We will define what a medication error is. We will describe 3 common examples of medication errors. And finally, we will identify 3 ways that nurses can decrease the rate of medication errors. By definition, a medication error is any preventable event that may lead to patient harm while the healthcare professional still has control of the medication. Although medication errors can occur anytime during the prescribing, transcribing, dispensing, or administering of medications, unfortunately, nurses have the highest percentage of errors, usually during the administration phase, anywhere from 3 to 36%. That range is so wide simply because many nurses just don't understand what a medication error is. The good news is we have the tools and the opportunities to decrease the number of errors and to prevent patient harm. Some common medication errors involve giving medications to the wrong patient, giving the wrong medication to the intended patient, or simply omitting a scheduled dose altogether. As mentioned, there are ways that nurses can help to decrease those errors. First, nurses should always be familiar with the medications that we are giving. It's impossible to memorize everything about all medications, but we must know where to find our good resources: medication books, computer apps, or simply a call to the pharmacy for backup. This step sets the stage for us to be lifelong learners within our profession. Additionally, we must limit distractions when preparing or passing medications. The red quiet zone around the Pyxis machine is a very good example of how to limit distractions. The third way that nurses can help to prevent medication errors, and I feel the most important way, is to always follow the 5 rights of medication administration, starting with the right drug, paying special attention to look-alike, sound-alike medications. The right dose. Are you required to perform any conversions to change from micrograms to milligrams, always paying special attention to the units of your medication? The right route. Many medications can be given by multi-routes, whether it be intravenously or orally, so always check and double check the right route of the medication. Additionally, the right time. Be aware of your facility's medication policies regarding time, with giving before or after the scheduled time. Paying special attention to PRN medications, has enough time elapsed between doses. And lastly, the right patient. Most facilities will look for and practice name and date of birth, the 2 patient identifiers, paying special attention that names that are spelled similarly or look the same. I like to compare the 5 rights of medications to a good recipe. When we know that the recipe contains all the steps that we need, and we know we're going to get a good outcome if we don't change anything, then that's what we do. We don't change anything, and we follow the steps without omitting anything. So a realistic example of how we could apply some of these changes would be, for example, we go in with a dose of haloperidol to the patient in room 5, but her armband has been cut off to place an IV. You must make an active decision on what you will do. Will you take the extra time to get the patient identified correctly, or will you use a workaround and just continue those medication administrations because you've given medications to that patient prior? And because we've used our resources and we're familiar with haloperidol, we know that this patient may be incapable of accurately providing her name and date of birth. Therefore, it's essential that we stop and get this patient properly identified before we go any further with medication administration. Through the use of this brief lecture and short scenario, we defined a medication error, we've described 3 common examples, and we identified 3 ways that nurses can help to decrease the number of medication errors. This was all supported by current evidence found in a 2018 article titled Collaborating on Medication Errors in Nursing, and a second article titled Pediatric Nurses' Perceptions of Medication Safety and Medication Errors, a Mixed Method Study, also from 2018. Thank you for your time and attention today. Please complete the short survey provided through SurveyMonkey and return to Dr. Kiefer within the next 3 days. Thank you.